HIE means Health Information Exchange. They are exchanging the health information from one covered entity to another covered entity. So that is for the health information exchange. So here I mentioned clearly. So health information exchange means information shared between the hospital to the provider. So this is the one billing. Then ABN, what purpose we are using?
When the
AB.
Medicare beneficiary requests or agrees to receive a procedure or service that Medicare may not cover.
So the person has to pay from their own pocket if it does not cover.
Yes, yes. So some reason that Medicare not paying the some claims. For that claims, what doctors will do means before doing the procedure or service, the doctors will inform to the patient, I will do this service. Suppose if it is not covered by the Medicare, then you are the responsible person. You have to pay money to me like that. Before starting the procedure, doctors will instruct to the patient. If patient is accepting, then he will sign in the form. Then only doctors will start the procedures. So main purpose to ignore the payment issues. That purpose. And HIPAA insurances not covered under what are all insurances. It is HIPAA rules and regulations not applicable. HIPAA rules and regulations not applicable to what are all insurances.
For all the automobile insurances, workers'
Okay.
compensation, and
Okay.
property and casualty insurances.
Yes. So these three not under. In exam, they are asking option they are giving workers' compensation. Which of the below not under HIPAA? So that question answer workers' compensation. So HIPAA, starting what purpose initiated means to give the rights and protection for the beneficiaries and group health plans. That only given, but here what one option that option not giving in exam. They are giving some incentive for the who maintaining who's handling securely the PHI information. For that doctors need to give the incentive. For that purpose initiated like that one option is there. So if it is coming this question, you can select that option. Please. So
Okay, sir.
you can remember that. Then medical necessity. Medical necessity means one treatment is given in proper circumstance. One surgery or one treatment given means that appropriate diagnosis should be present in the medical record or not. So that is the medical necessity. While coming medical necessity, we have LCD and NCD. LCD means in state level what ICD they are linking to the what procedures. That is listed in the local coverage determinations. In whole US, what ICD they are linking to the what procedures. That is called national coverage determinations. So if any medical necessity related question it is coming in exam, please look LCD or NCD option is there. Please select that. Okay. So you have to know that. Then Medicare Part B covers what visits?
OP, counseling,
Yes, outpatient visits.
vaccinations. Yes.
Yes, yes.
Advanced counseling, chemotherapy, durable medical equipment such as wheelchairs.
Yes. So outpatient settings, then yeah, supplies that all covered by the Medicare Part B. So one question it will come, clinical infusion given is covered by what insurance? So what Medicare means? Medicare Part B covers clinical infusion. This one. Medicare Part B covers clinical infusions. This coming, you can select. This is the correct answer. Medicare Part A covers what visits?
IP, hospice, home health.
Inpatient, hospice
Skilled
care, SNF, home health care. So this is all covered by the Medicare Part A. Medicare Part C covers
Include Part A and Part B, and
yes,
additional benefits.
yes, combination benefits of A, B, and D. Then Medicare Part D,
Drugs and prescription.
prescription drug coverages. So, so fraud means intentionally, voluntarily making false statement to get the money from the insurances. That is the fraud. Knowingly, voluntarily, intentionally they are doing. So here they given one option. X-ray performed without the patient order. Patient not ordered, but they are doing enough. Then it is one example for the fraud. Okay. Then what is category 2 codes? What is category 2 codes means what?
The following section of CPT contains a set of supplement tracking codes that cannot be used for performed measurements.
Hmm. So how digits present?
So what?
How many digits present or what is the structure of the category 2 means? Category 2, what is the how it is format present? I'm asking how many digits? Any specific any differences between category 1 and 2? So what is the last character in category 2? Fifth digit ended with what? Category 2,
T, F and T,
T,
T and F,
F.
I guess.
T and F. How it possible T and F? Any one only you have to say. What is that?
Category
Please
2 is
check
F
and
and
tell book.
category 3 is T. Category 3 is T, they are temporary codes.
Then category 2.
F. F.
So 1 to 4 digits numbers, fifth digit ended with F. That is the category 2. That category 2 to find what purpose we are giving mean to measure, to give the information about the physician quality, how he is working, how he is taking care of the patients. So physician quality reporting system for measurement of the incentive. Because based on that only they will give the incentive. One doctor is doing well, he is taking care of the patient. Based on that, they will give the incentive on that. So category 2 codes, 1 to 4 digit numbers, fifth digit ended with F. Category 3 means 1 to 4 digit numbers, fifth digit ended with T, T for temporary codes. Okay. Then, what is the full form of PHI?
Protected health
Protected
information.
Okay. Overall comes under covered entity.
HIPAA.
Okay, covered entities means overall.
Medic. I guess 1 second, sir. The entities are the healthcare providers, a healthcare plan, a healthcare cleaning house.
So first one is all insurance companies, all payers. Second one, all providers.
And last one is cleaning house care.
Healthcare clearinghouse. So these three comes under covered entity. Okay. Then in operating room means we have two parts. One is what? Two we have, right? What is that?
Heading. It contains heading and
Header.
header
Header
and
and
body.
so in header, what all you will look?
In header, we look for 1 second, sir. The header should contain date, time of the procedure, name of the surgeon or surgeon or assistant surgeon, type of anesthesia and anesthesia provider name, pre-operative, post-operative diagnosis, procedure performed, and complication.
Yes, so this all comes under header. In body,
Indication of for surgery and detail of the procedure and findings.
yes, yes. So you have to know clearly this. How the question they are asking mean which of these following not under header? Which of the following not under body? So if you know what all it will come header, then only you will able to answer. Okay, so that's it. So you can take the code in CPT book 4000F, 4000F.
So where is this? Like we didn't got we got 4004.
Yeah, 4000F only. 4000F.
Yes, sir.
Tobacco use cessation intervention, counseling for COPD, CAP, CAD, asthma.
Okay. So if they are mentioned tobacco use means this code. If they are saying pharmacological therapy, then you can use this code. In this two one question it will come. While checking if they are using for tobacco cessation 4000F. So for pharmacological therapy given, then 4001, sorry 4001F you can give. Hmm. So in this related question it will come. Next. Hmm. Okay. Major surgery, how many days global period?
90.
90.
Okay. And what is mean by NCCI edits?
It tells that like which two if we are coding some procedure, two different procedure, it will help us to know like we have to give modifier or not with the codes.
Yes, yes. So NCCI edits is the National Correct Coding Initiative. So what purpose means? Suppose in one encounter, doctor done two procedures. The two procedures can code or not based on the NCCI edits will come to know. While checking edits, we have the indicator 019. If a two column one, column two, two CPT code is there. One code listed in the column one, another code listed in the column two, and nearby they will give the indicator also. The two codes codable or not, how we have to come to know means while checking the indicator, if it is showing, wait, I will show that. I shared this. You got this image?
It's in black color.
Black color. Okay. One second.
Yes, so we can see.
So this is the NCC edits. We have some. I give an example here, but we have more CPTs they will give. This is the column one. This is the column one, and this is the column one. So two procedure. If these two procedure if done in one encounter, we need to know this both can how we have to design mean based on this indicators. 0 means not allowed, 1 means allowed, 9 means not applicable. So this two code 92557, 92552 while looking, it is showing indicator as 0. 0 means what it is saying? It is not allowed. Not allowed means these two CPTs should not code. We have to code only column 1 CPT, that is 92557. So like that, we are checking for, we need to code all the procedure at a same encounter or not. Based on this NCCI Edits, we can come to know. And if it is showing 0 means not allowed. Suppose if it is showing allowed 1, see 92604, while checking 92604 CPT and 92570 CPT, while seeing the indicator it is showing for the 1. That means you can code both but by using the modifier. 1 means allowed but with the help of the modifier. Okay. So NCCI Edits main purpose of proper billing and coding, that purpose only initiated. So you have to know indicator what is that 0, 1, 2, based on you have to tell. Then what is mean by RVU?
Revenue, are we revenue? Uh, 1 second. It's the amount of the particular procedure or
Yes,
particular unit.
yes. So how much amount need to pay for the particular CPT, which is calculated by the RVU. So if any question it is coming, so for billing, for reimbursing the particular CPT amount, so that is the relative value units. So you have to know that.
So what is the full form for that?
Okay, okay. Relative value unit. Relative value unit. Relative value
So
units.
for
Tell me.
global period,
Hmm.
90-day global period has night covers 92 days, right? And 10-day global period
How
covers.
if they are asking question 90 days global period, how many days it will cover, like that question it is coming, then you can tell 92.
Okay.
Suppose
And for
in
10
question,
days?
yeah, if 10 days they are asking how many 10 days global period, how many days it will cover, like that question they are asking, you can tell 11.
Okay. Yeah.
But if not mentioned, it is 10 days or 90 days not mentioned in question, simply they are asking major surgeries how many days global period, then you
Hmm.
can select 90 days.
90 days. Okay. Okay.
Okay, so you have to aware of that.
And some minor surgeries, both 0 and 10, right?
Yes,
Yeah.
yes, 0 to 10. Okay, so this is the question. And so which is not used in the outpatient sets? Which code sets? Which code sets you will not use in the outpatient setting? Which code sets you will not use in outpatient setting? Your options: ICD-10 CM, CPT, HCPCS, ICD-10 PCS. Which code sets will not use in the outpatient settings? One is for ICD-10 CM, then CPT, then HCPCS, then last one is ICD-10 PCS.
ICD-10 PCS. We don't know what that is, but
Yeah,
that's the option probably.
yes, yes, that is the correct answer. ICD-10 PCS will not use in the outpatient. It is for only the inpatient setting. Overall working in the IPDRG, those people will use. So we have to know this. This is another repeated question. Then one second. What is the full form of OIG? OIG. What is the full form?
Organization,
Hmm?
Office of Inspector General.
Yes, yes. Office of Inspector General. Okay, so you have to know this. Okay, so now I'm telling some anatomy questions. So last week came water questions. Already we discussed or not? One second. So Cowper's gland relates to what system?
Which
Cowper's
gland?
Cowper. Cowbergland. Cowper
Reproductive
gland.
system.
What?
Gland. Endocrine, sir.
So it is the male genital organ. Okay.
Okay.
Mm. Then, so you can remember this question. It is coming. So how they are asking mean, which is not a female reproductive system. That is a question. Another three option which is related to the females. Option they will give Cowper gland. So you have to select Cowper glands not under the female reproductive system like that. Then cryopreservation cells are stored in cells are stored in very low temperature with the help of the liquid nitrogen. That is for the cryopreservation. Then X-ray beam enters back of the body and exit front side means it is the PA view, posterior anterior view. Then thyroid gland relates to endocrine system. Then thoracic duct relates to spleen. Thoracic duct relates to lymphatic system. Spleen also belongs to the lymphatic system. Another one. Proximal to humerus, what it will come? Proximal to humerus.
So I didn't get the question.
Proximal to humerus. Proximal to humerus, what it is present?
Shaft.
Humerus is the bone, right? In that proximal means
Yes.
upper end. In
Upper
humerus
end,
upper
yes.
end, what it is present?
Shoulder.
Shoulder, yes. So which joint having ball and socket?
Knee.
Knee.
Shoulder.
Shoulder is the answer,
Then
correct answer.
Okay. Yes, shoulder.
Then which is strongest, most muscular chamber? Left ventricle. Okay. Then which is the not part of the upper respiratory tract? Option nose, throat, trachea, pleural cavity.
pleural cavity.
Yes,
Pleural cavity.
pleural cavity is the correct answer. Which is not under lower respiratory tract? Nasal concave, bronchus, bronchioles, alveoli.
Nasal cavity.
Nasal concave.
Nasal concave. Okay. What is mean by meningitis?
Inflammation of the meninges.
Inflammation of meninges present in where?
Brain, sir.
Okay. Inflammation of bone and bone marrow.
Okay.
Bone and spinal cord.
Okay, I
Brain.
thought brain.
One second. Meningitis means infection or inflammation in the brain. Brain also meninges is there. Brain and
Yes.
spinal cord. Brain and spinal cord is the correct answer.
Okay, sir.
Then which is responsible for writing, eating? Which brain is this function? Which brain is responsible for eating, writing, and all? So this answer is cerebrum. Okay. So Adam's apple, otherwise called thyroid cartilage or vocal cord. Okay. Spleen function is filter and destroy the RBC cells.
Sir, pardon.
Spleen function.
Okay.
Filter and destroy the red blood cells.
Sir, what was the question you said after meningitis?
After meningitis, I asked for which brain function is writing and eating. I'm asking.
That is cerebrum.
Yes, cerebrum. Next one I said Adam's apple, which is called Adam's apple. So that one I said thyroid cartilage or vocal cord. That is for the uh, Adam's apple. The next distal to elbow. Distal to elbow means what?
Wrist.
Below the elbow. Forearm, wrist.
Yes, wrist. Menorrhea means normal menstruation. And another one. Okay, so these all the repeated questions. To explain, I said. So, which is the below the organ from mediastinum? Which is present below the mediastinum?
Thymus.
Yes, thymus. And so, dacryocystectomy. Dacryocystectomy means it is the removal of the lacrimal sac.
Lacrimal cyst.
Hmm.
Sac. Okay.
Yes. Then okay, so sciatica pain relates to radiating to legs. Okay, so this is that all our anatomy questions.